Good evening. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is the Los Angeles Basin and South Channel Islands, where UCLA sits. My name is Inez Ponce, and I am the director of the UCLA Center for Health Policy Research and Professor and Fred and Pamela Wasserman Endowed Chair in the Department of Health Policy and Management at the UCLA Fielding School of Public Health. Thank you for joining us today for our webinar, diving into CAPIWAVES, examining mental well-being and COVID-19 economic impacts among Native Hawaiians and Pacific Islanders in California. Since the beginning of the COVID-19 pandemic, Native Hawaiians and Pacific Islanders have experienced the highest COVID-19 mortality rates of any race or ethnicity in California. However, there has not been a statewide assessment of NHPI mental well-being and socioeconomic impacts until now. From January 2024 through May 2024, researchers at the UCLA Center for Health Policy Research's NHPI Data Policy Lab, UC Irvine, and UC Riverside partnered with 10 NHPI community organizations and leaders representing CHamorro, Fijian, Marshallese, Native Hawaiian, Samoan, and Tongan communities, many of whom are here today, to conduct the California Pacific Islander Wellbeing and COVID-19 Economic Survey, known as CAPIWAVES. Using a unique community-driven sampling method, the CAPIWAVES project has resulted in the largest data set to date of NHPI mental well-being and socioeconomic status in California, with more than 900 participants. I think we're almost at 950, so more than 900 participants. And I cannot emphasize enough the importance of community voices and community leadership in making this happen. We are so grateful to everyone that's joining us here today and everyone who played a role in making this happen. So today, you will hear from our wonderful researchers and community partners, including Dr. Brittany Morey, an assistant professor of public health at the University of California, Irvine. Dr. Morey is the principal investigator of CAPIWAVES, and her research focuses on how structural racism shapes racial and ethnic health inequities. Karina Pinaya, data analyst for the CAPIWAVES project and community engagement and research director, and co-founding member of our NHPI Data Policy Lab, Most importantly, she's a doctoral student at the UCLA's Department of Health Policy and Management. So watch out for Karina in a few years as she'll be leading a lot of these studies. Melanaita Fifita, Staff Research Associate and Patient Navigator in the Office of Community Outreach and Engagement at UC Irvine, who will talk about the importance of NHPI data. Melanaita, I'm so glad you're here today. I so admire your work. So before we share methods and results, I would like to welcome someone many of you know well, Calvin Chang, who is a director of the NHPI Data Policy Lab and also a co-founding member of the lab. Calvin?
Mahalo for the introduction. Next slide, please. I'd like to first acknowledge that the work we do would not have been possible without some of the elders who had been doing this work for decades before us, and my mentors like Jane Ka'ala-Pang, Victor Kaiui-Pang, and Kevin Young. The Native Hawaiian and Pacific Islander Data Policy Lab has established 3 pillars for serving our communities. The first is making NHPI data accessible through numerous dashboards that presents disaggregated COVID-19 and social determinants of health data, because if it's not accessible, it's not equitable. Communities need timely access to accurate data that reflects who we are. The second pillar is providing trainings to strengthen the community's capacity to work with data. Ensuring our communities understand our own data, know where to find it, and can use it is essential for controlling our own narrative. And third, coordinating advocacy efforts to advance equitable data policies We've released the first NHPI data policy platform, which was a result of contributions from 138 NHPI leaders across 13 states. It advocates for the inclusion of NHPI voices throughout the data pipeline, and we also help organize nearly 60 organizations in drafting and submitting letters in support of the newly announced federal revisions to its race and ethnicity standards. Again, what we do isn't possible without the work of organizations doing the work on the ground. Next slide, please. At a fundamental level, data is a civil rights issue. On the left is a photo of Martin Luther King Jr. on his third march from Selma to Montgomery, Alabama. The leis were a gift from the first chair of Hawaii's Civil Rights Commission. The civil rights movement led to civil rights legislation that you can see on the right side of the slide. And these bills require federal agencies to use race and ethnic data to monitor compliance and to protect those who have historically been discriminated against. Because if we don't exist in the data, we don't exist in the eyes of decision makers, policymakers, and those with resources to help out to help our communities. Next slide, please. And we saw that during the first few months of the COVID-19 pandemic, the NHPI community experienced an extremely rapid rise in case and death rates that were higher than for any other major racial ethnic group in most states reporting our data. And being able to see this data helps enable organizations to argue compellingly that our communities need to be prioritized for resources. Next slide, please. And we've seen what happens when we're not accurately portraying the data. As of last year, a majority of California counties were reporting COVID vaccine rates in excess of 100%, an impossible figure that made it more difficult for our organizations to advocate for resources. And as we move forward, we hope to present more data like those in CAPIWAVES that speak to the challenges NHPI communities in California face, as well as our community's potential. Mahalo.
Thank you, Calvin, so much for that beautiful explanation of the importance of NHPI data and data disaggregation. We're really pleased to have you all here today to share the initial findings for the CAPIWAVES project. And I know many of you here touched and supported this project, so thank you again. CAPIWAVES stands for the California Pacific Islander Wellbeing and COVID-19 Economic Survey. And before we progress with the rest of the presentation, we wanted to take some time to pause and recognize our position with regards to this work. Speaking on behalf of myself, as a researcher and an academic at UCI program in public health, I can recognize that I myself am not someone who identifies as Native Hawaiian and Pacific Islander. I'm fourth generation Chinese American. But in my 15-year-long career in public health, I have had the true privilege of being able to work alongside NHPI communities. And it has been truly my honor to humbly contribute to work that, as Calvin has also said, was started long before I joined this field and will also continue past the time that I retire from this field. I've been really glad to be part of work that advances health and social equity, being able to be part of work that collects and analyzes data in a way that engages community members in that work. And so I see my position in this work truly as a researcher who is community engaged and doesn't seek to speak on behalf of the community, but who seeks to uplift community voices in doing this work. And now I want to hand it to my co-presenter, Karina Panaya.
Thanks, Brittany. Talofa and Fafatai Tilalava to all who are attending today's call to really learn about our work and the CAPIWAVES survey. My name is Karina Panaya, and I am a proud daughter of Samoan parents who moved to the States in search of enriching opportunities for our family. And so the sacrifices of my parents and my ancestors have really led me to where I am today, as I learned to continue how to be a good data caretaker for my community through my roles as a co-founder of the NHPI Data Policy Lab and also a PhD student at the UCLA School of Public Health. As I continue to generate new research ideas and projects. I am very grateful to lean on trusted community members and knowledge experts in this field who continue to share their insights and inform the future projects that I plan to pursue in the future. From these experiences thus far, I've really learned the importance of community engagement and how critical it is to incorporate community members and their expertise at every level of the research design process. And through this, we've been able to lean very heavily on our community partners to generate more research as the NHPI Data Policy Lab and continue to work together as we identify new problems and propose new solutions.
Thank you, Karina. Just to give you an overview of what we'll be talking about for the rest of today. First, we'll be going over a background of the CAPIWAVES project, and then we'll talk about how we collected survey data for this survey for to date the largest in California for Native Hawaiians and Pacific Islanders on mental health and socioeconomic well-being. Then we're going to go over the initial results and talk about our next steps in this process. And there will be time at the end for questions and answers. I'd like to introduce our CAPIWAVES team. At UCI, it was myself, as well as Dr. Sora Park Tanjasiri, who is another co-investigator on this study, and has had many years of experience conducting community-based participatory research, in particular with Native Hawaiian and Pacific Islander communities. At UC Riverside, my co-PI, or principal investigator, was Dr. Andy Subika, who has also had much experience working with Native Hawaiian and Pacific Islander communities and has expertise in mental health and substance abuse. And then, of course, at the UCLA NHPI Data Policy Lab, Karina Panaya, who's here with us presenting, was instrumental in collecting the data and analyzing the data. And Calvin Chang, who is our leader and director at the lab. Kristen Marquez, who is our program manager at the lab, and Dr. Nines Ponce, who is a co-investigator on the CAPIWAVES project and who you heard from at the beginning. This webinar wouldn't have been possible without the help of our wonderful communications director at the Center for Health Policy Research, Tiffany Lopes, who put together this webinar and all of our promotional materials. Also, Royce Park, who is an assistant director with the California Health Interview Survey, who helped to consult and inform us on how to best analyze the data using our data analysis techniques. And then our volunteer, Cynthia Folk, who was really instrumental in making sure that our data was collected well and making sure that all of our participants received our follow-up emails and our incentives. This project truly would not have been possible without the wonderful partnership of our various community partners. So I wanted to spend some time to thank each and every one of them, including Bernadine Tuisa-Valalo with the Central Valley Pacific Islander Alliance, who helped to connect us with Pacific Islander communities in the Central Valley in California. Carla Thomas with Empowering Pacific Islander Communities, who is also a former founding lab member and who helped us to connect with leaders and communities throughout the state. With the Coutura and CHamorro Foundation, Heidi Cuenga, with her deep ties in the CHamorro community, was able to connect us with CHamorro folks throughout the state. And similarly, Kaylani Silk, with the Marshallese youth of Orange County, and her deep ties in the Marshallese community, was able to connect us. Una Vuni Dakua, who is the head of Radio Bula Duavata, a one-of-a-kind Fijian radio station that brings wonderful news to Fijian communities, who helped us to connect with the Fijian communities throughout the state. In Northern California, the Samoan Community Development Center, we worked with Danny Boy, Nahavevalu, and Tupo Latukepu, who helped us connect with Samoan and Tongan communities in Northern California. And in Southern California, our representatives from the SoCal Pacific Islander Community Response Team, Alisi Tulua and Auntie Audrey Kawaiapua Alo, were very instrumental. We had other community leaders helping us as well, including Tana Lapule. So I want to extend our deepest gratitude and thanks for all of these wonderful community partners and look forward to continued partnership. For the CAPIWAVES project, we were funded by the California Collaborative for Public Health Research, or CPR3. And through this funder, we actually applied to 2 different grants. One that was focused on mental health and well-being, and that was the CAPIWAVES proposal. And we also applied to another grant that wanted to focus on how the COVID-19 pandemic impacted the socioeconomic well-being of NHPI communities. We ended up getting granted both awards, and so we combined the 2 projects, CAPIWAVES and CAPIC, into one survey, which became CAPIWAVES. So the purpose of CAPIWAVES is to illuminate the mental health and socioeconomic impact of the COVID-19 pandemic on California's Native Hawaiian and Pacific Islander, or NHPI population. Our aims were first to assess mental health, stress, discrimination, and mental health care access among NHPI adults in California. And our second aim was to examine socioeconomic status, access to government public socioeconomic supports related to income, housing, employment, and food security. And we wanted to collect these data in a way that represented as much and as accurately as possible the entire population of NHPIs in California. And by doing so, we can accomplish our aim 3, which is to disseminate that data and the findings back to NHPI community leaders and to have this data in their hands so that they can be informed for their own advocacy and their own efforts in the community. Now, Karina Panaya will take the presentation from here.
Great. So in terms of survey participant eligibility, we did have 3 criteria that we used to ensure that we were collecting surveys from appropriate people. And so we collected data from those who were 18 years and older. They reside in California, and they self-reported as Native Hawaiian or Pacific Islander. So we want to talk a little bit more about the sampling method that was used for our CAPIWAVES survey. And so oftentimes researchers and policymakers have critiqued that shared NHPI data comes from a convenience sample, or it's collected from one's friends and family. And so to really challenge this narrative, through the CAPIWAVES survey, we use respondent-driven sampling as a method to collect a representative sample and understand what is actually happening in the population by getting deep into the social networks through this wave-like approach. RDS combines snowball sampling, in which our community partners have played a critical role in shaping who we identified as 60 seeds to complete the survey. And they then recruited the first wave of participants to take our survey and recruit. And the wave continued, so on. And so the snowball sampling combined with a mathematical model was used to weight the data that we will be sharing a little bit more about later and compensate for the non-randomness of the RDS process to ensure that the estimates we are generating are representative. And this process continued from December 2023 up until the end of May. And once again, we really just want to thank all of our community partners who helped us continue the waves and continue to be our cheerleaders as we try to grow more of our sample. In terms of the original CAPIWAVES goals, these are some of our original goals that we put together at the very beginning of the survey. And so we aim to get a large sample of 800 NHPIs, representing 6 of the largest NHPI groups, including CHamorro, Fijian, Marshallese, Native Hawaiian, Samoan, and Tongan, within the 3 regions of California, so Northern California, Central California, and Southern California, with the goal in mind to report back our findings to community members who participated in our survey. And we are excited and thrilled to announce that we have reached our goals. As Dr. Ponce mentioned at the very beginning, we have collected data from 949 NHPI eligible participants, representing the 6 major Native Hawaiian and Pacific Islander subgroups. And we would also like to note that there are additional groups within our sample that were able to take this survey and help us understand a little bit more about the mental health impacts and financial impacts that were experienced during COVID-19. In terms of representation in the California regions, we had about a little more than half of our survey takers who reported living in the Northern California area, followed by 39% in Southern California, and leaving us with 5% in the Central California area. And so here we are today reporting back on our preliminary findings and really just grateful to all of the folks who have been able to push these waves along and continue to give us feedback on how to improve our recruitment processes. Thinking about lessons learned from what we've gathered so far is that respondent-driven sampling can be a useful strategy to recruit representative samples of hard-to-reach populations like Native Hawaiians and Pacific Islanders. Community engagement continues to be a foundational part of our research efforts. And so we just want to uplift that this is really important to our work, and we continue to value it and learn from those that are a part of the community. And in the future, we plan to learn more about this RDS process that we've used for the CAPIWAVES survey as a means to identify strategies to reach those that may be overlooked in Pacific Islander communities and continue to find new ways that other communities who face similar issues can really benefit from. And so now I want to hand it over to Melanaite Fifita to share a little bit more about the importance of NHPI data and provide that community perspective of those who took the survey.
Malo Pito Karina. Malolele, greetings everyone. I'm Melanaite Havili Fifita, and I have been honored to be tasked with sharing the community perspective for this project. I acknowledge that I stand on the shoulder of giants and many community leaders that have come before me to lay the foundation of this work. And so the greatest reward for a job well done for them is more work. And I acknowledge that it is the community partners that you heard of before earlier that were mentioned, the trusted messengers, and the voices of our elders that continue to carry our wave. So during the COVID-19 pandemic, we were told by the Orange County Healthcare Agency that the Native Hawaiian and Pacific Islander communities were 100% vaccinated. And we knew that data was not true because there were many people within our own families, within our communities that were not vaccinated. And thus we sent this photo that you see here on this slide of our faith-based leaders conducting weekly funerals for our communities. And we advocated within our own communities and the Native Hawaiian Pacific Islander communities, working with the County of Orange and the healthcare agency to notify them of the urgency to get our faith-based leaders vaccinated. And because of the deep partnerships and the foundations of those partnerships that were cultivated over decades, the Orange County Healthcare Agency responded with, yes, we will help you. This data is vital to us in that it was a social media post. This photo was taken from Facebook and given to them, but it was the narrative, it was the relationships that were cultivated over those many years. And it was those heavy hitters at the table that advocated for the community because there was no data for Native Hawaiians and Pacific Islanders that was accurate for us. It was those relationships that carried, and thus the policy was changed. And at the time, it was the age of 65 and older to get vaccinated and had to be a resident of Orange County. But we knew that our county, our community are not bound by county lines. And thus they also agreed to let them come to Orange County to get vaccinated. All the faith-based leaders that we suggested and their spouses came, and we welcomed them. We had breakfast ready for them. We had leis to welcome them in a culturally appropriate way to meet them where they are. And that is the importance of having NHPI data, is that it can support the stories that we tell. And thus this sampling method for CAPIWAVES was well met by our community in that every community member, we know that within our own identity, we have a role that contributes to the family as a whole. And thus, for this sampling method, it was the same concept in that there was a recruiter, there was a trusted messenger to follow up with those that were recruited, but there was also a strategy into capturing the data within our communities because we understood how vital the data is to our communities and how it can possibly help us to prioritize the programs that we need within our communities to meet our communities where they are at. And so the trusted messengers strategized how to recruit and to not duplicate efforts. There were different community leaders that were the seeds and different community leaders that followed up. There were also other community leaders that have roles as the helpers that help the voices of our elders, and that the survey was not taken in paper form, in which many of our elders had asked for, but we were ready for that because then we had someone step in to help our elders to capture that demographic and to then get the codes of referral to pass the wave on. Then those trusted messengers followed up with those waves. And then at the core of who we are as Pacific Islanders, everyone is valued within the whole. Everyone understands their role and works within that role. And so not only was there communication within communities, Tongans to Tongans, but we were checking on our brothers and sisters in the Pacific from different island groups of, hey, have you heard of this survey? If not, you can take this wave. And they then strategized. And by working together, we can ensure that our data is collected for us and by us, and thus our community can get the resources that they need and no longer suffer in silence. So thank you for allowing me to share in this space and this time. I'll pass it back to Brittany.
Thank you, Milanite, for that really beautiful picture that you painted for us and for your wonderful involvement in this project. So now we are very pleased to share the initial results from the CAPIWAVES project. So just to explain a little bit of how we can understand these numbers, and this will be true for the rest of the numbers that you'll see on the slides. As Karina had shared earlier, the respondent-driven sampling method used a mathematical model in order to create these estimates. And these are estimates that estimate the whole population of California Native Hawaiian and Pacific Islander adults. So you'll see on the next slides percentages, and so these are estimated percentages, and also these 95% confidence intervals. And so these are basically ranges that we could understand as, the true range for example, the percentage of CHamorro in California is probably somewhere between this range, and we could be fairly certain of that, about 95% confident of that. And so that's how we can understand these numbers. But here we just show the NHPI groups that were represented in the survey. So again, 8.2% who were CHamorro, 7.5 identifying as Fijian, 4.6 Marshallese, 15.2 as Native Hawaiian, 31.6% as Samoan, and 22.2% Tongan. We did have about 10% of our sample who identified as Pacific Islander, but did not specify a particular group. And we had other groups participate as well, although they were represented in small percentages, about 1% or less. We did see that other folks were able to take the survey, including Chuukese, people from Kosrae, Palau, Kiribati, Pohnpei, Rotuman, and Tahiti. As far as the age breakdown of our survey takers, we can see that we had people who took our survey from 18 years old all the way up to 80 years old. And we were able to capture some of the elders in the survey as well. But you will notice that a large percentage of people, about 39.3%, represented the 20 age range group, and 29.6% represented the 30s age group. And so this might be, you know, because the population is a bit younger, but it could also be because people were more likely to take the survey if they were, you know, internet savvy and able to take the survey and pass it on to their friends and peers who were around the same age, in the younger age ranges. As far as the gender identity of participants, for those who identified as women, 60.1% identified as that gender, 35.9% identified as men. We also had about 1% identify as non-binary and 1% identifying as transgender. We also had people who identified as other or who preferred not to say a particular gender. In terms of sexual orientation, 80.8% identified as straight, and we also have 8.4% representing those who are bisexual, 3% representing those who are gay, and 2.5% identifying as lesbian. And again, we have people who were other or preferred not to say. So we were pleased to get representation from our LGBTQ participants. Now, here are the first results for our mental health findings. One of the questions that we asked folks was, on a scale of 0 to 10, how much distress have you experienced since the COVID-19 pandemic? And we defined distress as feelings of anxiety, sorrow, or pain. And so here are the results. 44% identified experiencing no or low distress, and so they ranked their distress anywhere from 0 to 4. But a larger percent, 47%, identified moderate distress, and so they scored themselves 5 to 7 on a scale of 0 to 10. Whereas 9%, or almost 1 in 10 people, identified experiencing high distress since the COVID-19 pandemic. And so they rated themselves as experiencing 8 upwards to 10 on a scale of 1 to 10 for distress.
So focusing more on the sources of stress, we see a diverse variety of stressors. And so this includes health and financial concerns, employment impacts, impacts on elderly in the community, social distancing, social isolation, and more importantly, disruption of community events. And we were really interested to understand how these different stressors were impacting folks in the community, and we'll continue to look into more of the impacts on this. In terms of coping, we see several coping strategies that facilitated mental health, including socializing with friends and family, meditating, praying, family activities, thinking about TV screen time. Some folks reported eating more and snacking, and attending community religious events. We also looked at anxiety and depression, and we used the Patient Health Questionnaire, PHQ-9, to go ahead and measure that, and the General Anxiety Disorder Screener to help us measure anxiety. And so we see that nearly 16.2% of our survey takers reported moderate anxiety, followed by 5.4% who experienced severe anxiety, and about 7.5% of them reported major depressive disorder. In terms of mental health care seeking, we were really interested in understanding of those who identified having mental health impacts, how many of them were either seeking mental health care services or delaying for specific reasons. And so we found that 22.7% of our survey takers have sought mental health care services, and about 16.5% of them have delayed seeking services. Moving on to the financial impacts. During the pandemic, we know that individuals were financially impacted. Among those within the same household that experienced pandemic income and job loss, we see that 44% of our survey takers experienced household income that was the same since COVID-19, 35.3 of them with income that is less since COVID-19, and 31.2% of at least one person in the household lost employment or significant income during the pandemic. We also learned that Pacific Islanders had challenges with basic necessities, paying for house and rent, thinking about how to obtain childcare, as well as other financial difficulties that were reported during our survey. And so during COVID-19, we know that within California, funding was available through stimulus checks. And so about 51.4% of our survey takers actually received support through this pathway, and 24.1% did not, followed by others who either didn't know or preferred not to say. In terms of how our survey takers use the stimulus money to support their daily life, this opened up opportunities for folks to pay for their rent or mortgage, think about food and other essentials, paying down some of their bills, as well as debts, caring for family and our elderly, and also being able to pour into savings and thinking about how to pay for healthcare expenses. And we were also interested in learning more about the type of assistance that NHPIs received during the pandemic. And as you can see, there was, once again, a very diverse representation of pathways and different funding mechanisms that people were able to access this assistance. And so folks reported that they were able to receive unemployment benefits, thinking about SNAP like CalFresh and food stamps, government health insurance, accessing food pantries, going to church or religious organizations and other community organization events. For the summary of our findings, we continue to see that NHPI communities are facing mental health impacts along with financial difficulties. But one thing that we are reassured with is that we know NHPI communities are strong, they're resourceful, and they are able to be resilient through pandemic and similar times. So really reaching into their social networks to find that support and help them recover during the pandemic has been one of the main findings that we are hopeful about. And last but not least, we know that more financial assistance is necessary to continue supporting NHPI communities. And so hopefully through the data we've gathered, we are able to put different reports together to understand what some of those needs are and propose some strategies to address them. In terms of our limitations, our project data collection lasted about 5 months, with the waves starting at different times, depending on when we were able to identify those important seeds to start the surveys. For our online survey, the CAPIWAVES survey was conducted online. And so this was really for people who were able to access the website, log on, and take the survey, and we only offered it in English and Marshallese. This decision was based off of ongoing conversations with community leaders to understand what some of the language needs are and which communities would need that type of translation. And thinking more about representation, as we've shown so far today, we were able to use this RDS sampling method to gather a large and representative amount of NHPIs throughout California. And we are looking to do more studies to see how representative those population estimates are, and to ensure that what we are sharing is something that can be really useful for other communities. And we are going to finish off with some next steps. We are looking to analyze more of our data with the CHamorro, Fijian, Marshallese, Native Hawaiian, Samoan, and Tongan groups. and follow up with some of our community leaders to understand what some of the relevant questions are to their work and how we can utilize this data to uplift some of their needs. And then we are planning to apply for more funding to continue doing more of this community engaged work, learn about sampling methods such as RDS, and find more ways to work with community to ensure we are generating research that really represents what's happening on the ground. And so with that, we just thank everyone for being here today, and we will move on to questions.
Mahalo, and definitely appreciative of the presentation of the data and our first look at the results. We have a question from the participants. Were surveys conducted in NHPI languages? Were there translators or interpreters available? Dr. Mori, Karina, would you like to respond to that?
Sure. Yeah. So when we started this project, we reached out to several of the community leaders and asked, whether translation might be useful or necessary. What we heard was that, especially to reach Marshallese folks, especially more of the elders and other within the Marshallese community, that it would be important to translate the survey into Marshallese. And so that's what we did. And thank you to Kaylani Silk for providing that. We did see that some people took the survey in Marshallese, and so that was nice to see that that translation was helpful to the communities. But I do think that, it was a little difficult with the survey being online. So, it's hard to see, we heard from Melanite that I think if some in the community were able to help people walk through the survey, but I'm not sure if that was available to everyone. But hopefully by providing that translation, it at least made it a little bit easier for folks to take the survey on their own devices.
Thank you for that. We do have a somewhat related question. Did the survey address limited English proficiency? Dr. Mari?
Yeah, so we, did our best to go through all of the questions at the beginning before we launched the survey and tried to make sure that the reading level of all the statements and the questions were at most at the 8th grade reading level, 7th or 8th grade reading level. And so, we did our best to do that. Of course, some of the questions are, standard questions. For example, the depression screener and the anxiety questions, those come from these, people have been using it for a long time in clinical settings. So, we couldn't really change those questions a whole lot in order to make them comparable to other studies and other research that uses those measures. But what we did was we did try to define certain terms when we use them. For example, we tried to define mental health. We defined anxiety, distress, these words that may not be as common. And then, hopefully that helped with the understandability of the survey. But yeah, but for folks who might have, less English proficiency, lower than like a middle school kind of reading level, it might have been difficult. We might not have been able to reach all those folks. But we tried to do our best, and yeah, I'm open to community feedback and as far as how we could perhaps do that better in the future too.
Yes, thank you for that. We have a comment and a question. Thank you for a wonderful presentation. The survey covered a lot of important topics. Did you notice if any of the questions had higher non-response rates than others?
Maybe Karina can speak to this too, but I think that there were certain questions where we knew that they were more sensitive. So we did provide that option of, people could say, I prefer not to say, or I prefer not to answer this question. The way that we structured the survey was that, people provided the answers and then moved on to the next question. So there were people who maybe stopped the survey midway and didn't complete the survey. So we did have some of those. And so some of the questions towards the end of the survey were more likely to go unanswered since people couldn't skip around the questions. And so I think that kind of contributed to some of the non-response. That said, I think most people who took our survey were able to complete it. And so we were actually very happy with that. I think less than 10% didn't make it to the end. And so I think that's pretty good for an online survey of this type. And so we're pretty pleased with the responses.
Yeah, I just wanted to add a little bit more to that. As we continued to collect the data and go through some of the responses, we learned that folks were actually pretty good at filling out the questions. And I think that may have a lot to do with the community partners that we worked with, who really encouraged those who were taking the survey and recruiting to try and follow up with those who were taking the survey, or to provide that direct assistance, whether it was for in-language needs or to answer any questions. So it's possible that those folks who did have peers to help them through the survey may be a big contributor to why our data is fairly complete for the most part. For those who did not make it to the survey, we did do a lot of follow-up with those individuals through email to try and ensure that they were able to access the website again, and they were able to access the survey portal to try to get them to fill the survey out. But there was a lot of ongoing touch points where we were either communicating with the initial seed who helped start that wave, or connecting specifically with the person who was recruited to complete. So there was a lot of back and forth communication, not only with those who maybe didn't make it to the end of the survey, but also with the community partners who once again played a pivotal role in helping us continue the week.
Do you, and I think this question could be for either of you. Do you know from the first findings if mental health effects varied between the different age groups?
That's a great question that we're hoping to look into. We haven't looked at kind of the different associations between, say, age and mental health yet. These were just kind of the preliminary results, but we would be happy to look into that. And if you want to follow up with us to kind of get those results, please feel free to contact us, and we could kind of run those analyses and look at to see if there's any age differences in mental health.
We have one of our questions from the chat, and I think that perhaps this might be a question for Naite. What were some of the main challenges that you faced establishing community partnerships?
We have built the community partner. We have built on the many relations of the elders in the past, and in building new community partnerships, we had to make sure that the partners that we chose to link to came prepared with the same resilience that the partnerships that I had before with our elders. Not anyone can come into the community and establish a partnership right away. There's a little gate code that we hold up that we have to make sure. The challenge is that takes time. Partnerships take time. And for trust to be established within those partnerships, that takes time too. And so one of the main challenges was making the time to invest in new partnerships to build the trust over time. Thus, we can serve the community together. But we are constantly pivoting and building on the foundation of the relationships that we have from our elders. but also teaching and collaborating with new partners. And that there's a certain way to approach community that's culturally relevant, that's culturally appropriate, and that meets the community exactly where they are. Thank you for the question.
I think this next one could be for either Karina or Dr. Morey. Are there any other questions that you wanted to include in the survey but didn't this time?
Sure. So looking back now and from what we've gathered so far, it's pretty clear that social networks play a big role in terms of how people were able to access support during the COVID-19 pandemic, how they were able to find resources to cope with some of the financial impacts they were experiencing during the time. And so we are interested in looking at more of the peer recruitment process and identifying what some of those barriers and facilitators may be to ensure we are able to continue the waves, and maybe looking at the relationships between those who recruited and those who were able to share more about the survey. And so we're hoping to conduct a few studies on network relationships and how they can possibly be facilitators for some of the mental health and financial impacts that we've gathered thus far from the CAPIWAVES survey.
I think our, oh, I'm sorry.
Oh, go ahead.
I think our next question could be for you, Dr. Morey, or Naite. Thank you for the presentation and for the important work. What an impressive turnout of almost 1,000 people in such a short amount of time. What type of roles did your community partners have? For example, religious leaders.
I'll let Naita take this first.
Yes, thank you so much for the question. And as I mentioned earlier, is that the sampling method was appropriate to our community in that each person had a role. So there was the seed that was specific of finding the 4 people to start the waves. And so we know that our community belongs to faith-based, to civic clubs, but then what about the community that doesn't belong to those? We were strategic in responding to that by saying, okay, let's then target sporting events and hit that demographic there. Let's go to the voices of our elders and see who else, because the power within our elders and the wisdom that they carry, they know where to go. They know where our community members can be found. And in us collaborating with the partners that we've had, we were able to talk to one another and strategize with if Whaiwhikau Kitione has already started a wave or was received it already, then we knew, okay, that community is taken care of, we can move on. So it was a constant communication amongst community members, but it was the trusted messengers that were key, that they carried throughout the process. The trusted messengers that did the follow-up, but the trusted messengers also were the assistants to those that needed help. And then the seeds initiated who the waves would go to. I hope that answers. And everyone had a role that contributes to the family as a whole. And so in this concept, we knew that everyone could have their role and execute it accordingly.
Yeah, I think Bill and Naite put it really well. And that's, part of the key part of this being successful was that communication part. Because from the start, when we reached out to community partners, we didn't know where to go to reach out to these different pockets of people. We didn't know what the different pockets were, but the community partners were able to identify those seeds, who were then able to identify those different pockets. And by explaining the whole, goal of the project and how we wanted to make sure to reach not just the people who kind of always respond to this survey, who are part of the civic clubs or part of the churches, but maybe the people who wouldn't normally be a part of those groups. And so kind of by explaining this to the initial seed participants, they were able to say, okay, so I'm going to be real strategic with my 4 different referrals. I'm gonna, invite this one person who represents this church community, this other person who represents this other church community that I know of, and then another person who represents, this other group of people in Southern California or in the Bay Area. And so by explaining the whole research process and kind of the goal of the respondent-driven sampling to them, they really, were able to pick it up and really be strategic and try to reach as many different pockets as we could.
I think we have time for perhaps 2 or 3 more questions. I think actually perhaps we can combine 2 of them into one. I think this could be for Dr. Mori and Karina. The first of the 2 related questions is, will this survey happen on a regular basis to look at trends over time? And what are the future hopes and plans for CAPIWAVES?
So I can go, and then maybe Karina can chime in as well. So we would love to do this again. I think it kind of depends on, what the community members want as far as, what kind of data would be useful as the next step. I think by showing that this method could be successful within, a short period of time, 5 months, we could definitely, do the same method again, and maybe even, do a longer data collection if we had the funding, or on a totally different topic. And so I think it all kind of depends on what the community partners and leaders want to have data on, and what kinds of analyses would be useful in the future. And hopefully, by having these conversations, we can identify funding sources that can support that work so that we can continue to do this type of research. Yeah.
Yeah, I think for future hopes of CAPIWAVES, I'm really interested to see how the recruitment process works within RDS and identify some of the challenges that may have popped up. And so these challenges or barriers that we learn about can be used moving forward as a way to inform other communities that may find the RDS sampling approach useful, and really just figure out how we can best reach our Pacifica people to understand what's happening in real time. And really just going from there. And I also want to acknowledge Cynthia, who was also instrumental in this process. And she's another NHPI data policy lab member who helped us continue the waves and do a lot of the data collection and the recruitment. So I just want to give a little shout out to her because we are a small team, and we've continued to, be resourceful and find the best way to balance doing the outreach and doing the data collection, and also analyzing the data at the same time, and figuring out how to honor the community relationships we have, and just trying to absorb everything we've learned so far and figure out how to move forward.
I think this question can be for Karina or Naite. Do you feel that referring to the subject material as mental health versus mental wellness would make a difference?
I think this question really gets at our development and design phase of the survey that we put together. Initially, we had put together a survey and wanted to make sure that all of the language we used was appropriate according to the different communities we were outreaching to. And so this actually took a lot more time than we had invested for, but based on what we've shared earlier about very little non-response rates, it seems that going through this ongoing process and checking with community has been instrumental in ensuring that the survey is in an accessible format for folks, but also just taking into consideration how there are people who maybe aren't as tech savvy, and just trying to find other ways to do this RDS approach offline and kind of going from there.
And for our last question, I believe Dr. Mori, this might be for you. How did you define or balance timeline of the project, I'm guessing, with community, academia, and funders?
That was very difficult. Thank you for that insightful question. You know, our funding lasted for a year, and so we really had to hit the ground running. And again, I just want to credit our community partners for being willing to work with us in such a short time frame. Without them, without the relationships they had already built, the rapport that they already had, you know, the networks that they already had, this definitely wouldn't have been able to be done within a year. And it was less than that because it took us a long time to get institutional review board approval for this study because, you know, folks were not familiar with this study design. And so that took a long time. It took a long time to develop the survey. And then while we were doing that, you know, and once we got all of that, like reaching out to community partners and saying, okay, we have, you know, 6 months to do this basically. That was definitely challenging. But yeah, again, huge credit to the team and to all of our community partners for making this happen, because I don't know how we did it, honestly, but we were able to do it with many hands involved. So thank you, everyone. Yeah.
And thank you, everyone, for the questions. And we are nearing our end. Dr. Mori, if you'd like to close us out.
Thank you again for being here, everyone. This was wonderful. Please reach out to us if you'd like to be involved further or want any more information or uses of the data. We hope to continue this conversation. This is hopefully just the start of the conversation that we can have. And yeah, we look forward to hearing from you more. Thank you.